This episode is brought to you by Banfield Pet Hospital and proudly sponsored by our friends at Zoetis. Zoetis has over 70 years of experience in advancing animal health through a range of medicines, treatments, and diagnostics to help pets live their best lives.
Your call has been forwarded to an automatic voice message system.
Hannah Shot
Is not available. At the tone, please record your message.
Hi, Hannah. This is Janice from Utah calling. So excited you're back for season 2. So, I have an indoor cat, Oreo, who seems totally healthy and never leaves the house. I've seen online that she should be going in for annual checkups, but I'm just wondering, do I really need to take her to the vet every year?
Has your cat seen a vet in the last year? According to a recently published report, only about half of cats receive regular veterinary care, and they're far less likely to be taken to the vet than their canine counterparts. As a lifelong cat lover, this is heartbreaking to me, but it's a trend that I hear about a lot. People assume that they are more independent or that if they seem fine, there's no need to bring them in. But the truth is that cats are masters of hiding illness, and skipping out on routine care can mean that you could miss something that's quietly hiding beneath the surface. So today, we are going to talk all about why cats should see the vet. And we're joined by a very special guest who knows all about this topic. Joining me is Dr. Michael Kearley, a veterinarian with over a decade of experience in animal health, known for his compassionate care, his commitment to education, and his deep love for shelter animals. Dr. Kearley, welcome to Not Just Fluff.
Thank you. It's good to be here. This is a first for me, so really excited.
I know that you have a very special appreciation for feline medicine. I'm wondering if you can share what is so special to you about working with cats.
I remember in vet school that they would talk about cats as being not small dogs. And for some reason, that's just always stood out to me in terms of how they're treated, how we interact with them. Cats require such unique care and sometimes even love. They get a rap for not always being the most lovable of creatures. Having had cats myself and treated multiple throughout the years, like you mentioned, I do have a fondness for them. They are unique, and they make really good companions at the end of the day.
I love that. I am a major cat lady with several cats of my own, and I totally agree. That's why I'm excited about the topic for today, which is about vet care for cats, and specifically about why cats don't often receive as much vet care as dogs do. I hear it all the time. People say, I love my cat, but I just don't take them into the vet as much as I take my dog. So what do you attribute that to? What do you think are some of the factors that lead people to not bring their cat to the vet as often as they would their dog?
I mean, that's such a common thought, and unfortunately it's a common thought, right? What I've experienced in practice, and especially if we're comparing to dogs, cats are significantly seen less in the practice. At the end of the day, they need just as much veterinary care as dogs do. I would say it's probably a couple of reasons, honestly. One being is that when you're having to take your cat to the vet, it can also often be a difficult thing to do. I mean, having experienced that with my own cats, you get the carrier out, you try to find the cat, you have to put the cat in the carrier, hear her meowing the entire time to the vet. And so when we have such busy lives, as Americans, that it's just one more thing we have to do, and it's not an easy one at that. I think also too that sometimes cat owners may not be aware of the medical needs of the cat. I've heard it say that I'm going to get a cat because they often require less care. They're a little bit more self-sufficient. They may not display the same signs or symptoms as readily as a dog may. And so cats can be stoic by nature. And for the average pet owner, it's difficult to detect an illness, unfortunately, until it's too late, and then the disease has manifested itself, more severely than it may have if caught early. And so I would probably say that those are the three biggest reasons, at least that I've seen throughout the years.
Yeah, wow, so much to unpack there. I am with you. And I think your first point about the stress on the person bringing the animal in, I think I really relate to that. I have one cat who puts on an entire musical performance, and as much as I love musicals, it's like the entire way to the vet, he's just yowling and yowling,
Oh, poor
and
kitty.
that's tough
Yeah.
because he's a 14-year-old guy now, and he needs to go to the vet. So we've been able to find ways to manage that through like medication and even having like house calls for vets to come here so it's less stressful for him. For people who are listening that are like, that's my cat, what are some tips that you have for reducing stress for the cat going in to see the vet?
That's a good question, and I'm glad you brought that up. And I guess the first thing I would say to these owners is that you're not alone. I mean, I'm raising my hand. I'm right there with you. Um, a month ago, I took my cat in to have her teeth cleaned, and my son came with me. And he's like, Dad, she is not stopping. And I'm like, I know, I know. And so some of the things that we can do, like you mentioned, pre-visit sedation with anti-anxiety or anti-nausea, cats can get motion sickness, car sickness as well. And so that can contribute to their vocalization, like you mentioned. Having some favorite toys or treats, definitely when we think of preparing for the visit, that hungry is good. Okay. So, especially if your cat is food motivated. So, bringing their treats that they like or special, like up the ante type of treats, so makes it more of a positive thing. Planning for the visit, I think, again, we live such busy lives, but if you can schedule it, especially these healthier appointments or surgical appointments, if you can pre-plan it and have a little bit more time to factor in that it may take a little bit to get your cat to get into the carrier. And then we have to desensitize the carrier altogether. Don't just bring it out when you're going to the vet, right? That's going to signify, I'm going to the vet, I'm going to get poked and prodded. Bring it out or leave it out altogether. Make it a safe space. Use the feel away or cat specific pheromones, calming pheromones, or treats for that matter to, again, change that perception that this isn't a bad thing.
Now, you're a fear-free certified vet. Can you talk about what it means to be fear-free certified and what are some of the practices that come along with that when you're working with a cat?
Of course, yeah. And I would add that since we're talking about cats, I'm also a cat friendly veterinarian. So, both of which are just additional training courses that veterinarians or veterinary teams can take. And it really just improves the visit altogether. An old perception might have been, your pet is here. We're just going to get what we need to get done. Right. And really now it's taking a step back and evaluating the cat as a whole, right? Thinking about different factors that may influence its well being or quality of life. So, different types of restraint techniques to make it safe, for the associates, for me and my team, but also for the cat, right? So, that might be using toweling instead of scruffing techniques. We might be using treats or positive reinforcements. It might mean if the cat's happier in the carrier, we leave the cat in the carrier than putting it into this brand new, shiny, weird smelling kennel. At the end of the day, it's working with the client, the pet owner, and the cat to do the best care for that. Vets and vet staff, we love the profession because we love pets. And something I tell my clients all the time is nobody told me that my patients didn't like to see me, And so I wanted to change that narrative, right? And try to do more and be better for them because they deserve it.
Yeah, I love that because, as a person who regularly brings my cats to the vet, you can tell when somebody understands how to work with a cat and how to give them a good experience. So I love that you took those extra steps. Um, there is a kind of myth that I hear sometimes. Some people believe that if their cat is indoor only, that means that they don't need to go to the vet as often because they're not out there roaming the street, meeting other cats. Can you myth bust this for us?
That's such a common thought and a misconception at that because Yes, it's true that, contagious, feline illnesses, right, are going to be less on indoor cats, but cats are still susceptible to congenital or genetic diseases, still affected by hormonal changes and diseases, cancer, they're still affected by it. And so there's many things that they can be affected by that don't deal with the outside world. Even for cats that don't leave the house, you may have other pets that do, right? Or strays, wildlife, feral animals, in your and around your house that your cat may have access to, or like a screened in porch. And think about even for us as people, we leave our house. And so we're bringing in, parasites, fleas, ticks on our clothing, our shoes, and that's putting our feline friends at risk as well.
Yeah, I was gonna ask you to talk about fomites and, like, the fact that, we're out there, we're walking in the park. What's in the park is on our shoes come home. Can you kind of help people understand, like, the environment that is created in our home that even if your cat doesn't see other cats, doesn't mean that, disease particles can't make it to your cat?
When you talk about a fomite, fomite can be respiratory or aerosol droplets. So animals that sneeze or cough, right? It's this invisible um, germ, right? That's going to land on our clothing. We use our shoes to walk outside, right? And we're stepping on grass or dirt where an animal might have used the bathroom or urinated, right? And we're picking up those contagions. Our cat comes, smells our shoes, licks, us or our clothing, rubs up on us, right? That's going to be a way that we inadvertently transmit disease to them.
Another thing that you mentioned is how people might not notice that their cat is sick until their symptoms are quite severe. I know that in cats, the signs of illness can be a lot more subtle. So, what are some of the subtle signs that you notice people aren't aware of, and what should people be looking out for?
That's a good question because as we talked about, like earlier, one of the reasons why is that, cats are more stoic in nature and so less likely to demonstrate visible signs, right, to show that they're sick. So I think because of that, especially in early stages of illness, very subtle signs are going to be seen, and that often can be behavior changes. So your cat may be more reclusive than usual. Sometimes it's the opposite. They may be more vocal or prowling around at night, meowing at night. Certainly been seen with conditions like hyperthyroidism. Sometimes it can be just decreased appetite, or if you watch how your cat eats, dental disease is a significant disease in cats, and sometimes they'll just change the way they eat. So they eat with the right side instead of the left side of the mouth because it hurts, or they drop food, right? Or, a good practice is always to actually measure the amount of food, right? And see how much is your cat really eating, consuming in a day.
That was a lot, but I feel like it all boils down to change. If something is suddenly changing about your cat, and I see that a lot. I do a lot of adoptions, and I've actually had 1 or 2 adopters reach out, months after adopting or years after adopting and say, "Oh, my cat doesn't use the litter box now," and people will actually sometimes assume that it's like a behavior issue, like they're mad at them or something. Like, "My cat's mad at me. They're peeing on the bed," and I always say, "Okay, have you taken them to the vet?" And I will tell you every single time the cat has, a medical issue going on. So I think it is, you talked a bit about the reputation cats have. I do feel like it's so unfair sometimes to the cats because people think, oh, the cat's like being mean or being bad when really they're trying to express that they have a medical issue. Can you talk about that with specifically like litter box behaviors and behavior changes?
Even if it is a behavioral issue, right? At the end of the day, we want to rule out the medical issue first, right? Because cats can't talk to us to tell us what's wrong. So it's almost like we're playing a game of Clue to figure out what is it really boiling down to. And so we want to make sure we rule out all the medical issues. So when we talk about litter box habits, if you are noticing an issue, definitely have your cat evaluated. it needs to be cleaned on a daily basis, right? And should at least on a weekly basis at minimum be completely changed and cleaned out. Some cats, with the electronic litter boxes, can be afraid to go in it and use it because of the noises that the electronics can use. And then some cats may be averse to the type of substrate. So it may be a matter of changing it up and seeing maybe your cat prefers a different type of substrate. I do think that the like the dust free is always going to be a little bit better when we think about like deodorizers or perfumes, things like that. Also, kind of err on the side of not using those. They can be a little sensitive. When you think of like number of litter boxes, the rule of thumb has always been n plus one, meaning if you have one cat, you should have at least two litter boxes. They should be out of like high traffic areas, away from where like kids, of course, or dogs can get them, right? Everybody wants their privacy when they use the bathroom. And as your cat gets older, right? Maybe it's the type of litter box. If it has to like step in and get into it, it may be a little more uncomfortable with arthritic joints. So one that they can just kind of, walk straight into. And size, right? We want to make sure it's an adequate size for the cat to turn around, to dig, all of the normal behaviors a cat should exhibit.
Another big red flag for me when thinking about monitoring my cats is weight loss. I will keep like a monthly log of my cat's weights just because I want to be able to monitor and see if there are changes. So, what kind of monitoring do you recommend that people do at home? And maybe it doesn't need to be as over the top as mine, but what do you recommend for monitoring your cat?
No, I love that. I honestly do, because the more data we have, the better, right? Again, cats can't tell us with words what's going on. So I think the more data we have, the easier it is to tell a story, right? Kind of harking back to like, we like it's a clue, right? It's a mystery. I think for pet owners to really do the daily detective work of, looking at their cat, right? Again, it's not this, we want to change that misconception that they're low maintenance, they don't need much work or looking after, to interact with them on a daily basis, pet them, play with their joints, open their mouth, right? Again, be safe with it, but look in their ears, like see what's going on. See if you can tell a story that, oh, they cried out when I touched them here, or they didn't really like me looking in their mouth. And yesterday it was fine to do so, right? Logs are helpful too. The advent of automatic feeders can tell us a lot too, of how much is being fed, is it being consumed? Same thing with water. The litter box habits, are they going once a day, twice a day? What's normal for your cat? And now we're seeing a trend one way or another. It's important too when we think of like the environment, right? That to keep a lookout and see, are there any potential dangers? As an older cat, maybe we block off access to the stairs, right? Or maybe we use ramps, like little steps to the couch or something like that, to really change the environment to make it safer, but still a friendly place for your cat.
I want to switch gears and talk about wellness visits. So, in my mind, if cats are these mysterious beings that we love and know so well, I think wellness visits are a really good opportunity for people to maybe catch things that they didn't even know were going on. So, how often do you think cats should be coming in for a just regular routine appointment? And what happens at those appointments?
I think that cats should at least be seen on a twice yearly basis. So every 6 months. And there's so much that go on in those appointments. And sometimes I think we as veterinarians may not do the best of job communicating what we're doing, when we're doing it, but like a physical exam, right? Sometimes you see us just, and it looks like maybe we're just playing with the cat or petting the cat. But what we're really doing is a nose to tail examination. There's a good story that, if I could take a minute to let our listeners know that I had a cat come in. It was just in for a routine exam, some vaccines and some blood work, which everything kind of sounded normal. Heart and lungs were normal. Blood work looked normal. Nothing too crazy. It was an older cat. The owner had just mentioned it was slowing down a little bit. So again, kind of expected an older cat. And we talked about that. But when I got to my abdominal palpation was when I really had to take a moment and just kind of like, is what I'm really feeling there. And it was like a tennis ball firm mass in the abdomen. And so that's what we're feeling for, abnormal masses, thickening. And so in this cat, I did talk to the owner. Unfortunately, through testing, it did come back cancerous, but we were able to at least, give the cat some care and a little bit more time with the owner. And that was just on a routine exam, no presenting complaints. And so again, when we talk about subtlety, right? Just another call out, like we can't undervalue the importance of a physical exam.
All right. Well, we are wrapping up shortly, but I want to know if there was one message that you could shout from the rooftops and have every cat person hear it. What is the one thing that you wish everybody knew about their cats?
I guess in keeping, with the scope of what we're discussing for sure, like cats are masters at hiding, pain and illness. And so err on the side of caution. When in doubt, seek it out, right? I'd rather say that there's nothing wrong or we didn't find anything than for us, like the case I gave, and we detect something that could extend the life or the quality of life of your cat or prevent something worse from happening. So I guess, Hannah, at the end of it, I would have to say err on the side of caution. When in doubt, seek it out.
I love that. Now, you already gave us a great story of this earlier, but I want to see if you have another one. We have a segment called Tales from the Clinic, which is kind of where we're asking you about a story of a routine visit that caught something really serious, but caught it early in a cat. Do you have any stories of a person who brought in a cat for a wellness appointment who you were able to actually detect disease early because of that?
I have multiple stories, but one that would come to mind would be that this cat, it came in and ultimately at the end of the day, we had diagnosed diabetes. And very early, the client had just kind of mentioned that it had just been drinking a little bit more, but it wasn't quantifiable. Like it was just kind of this thought, he was having to fill it up and didn't really comment anything about litter box habits because usually it's going to go hand in hand, increase thirst and urination. It was an overweight cat, and so you're kind of putting two and two together, like could be. Let's do some routine blood work. It's healthy enough. We can do some vaccines. Typical deworming and heartworm and flea control to go home. And then I get the blood work results back, and I'm like, okay, we have to pivot. This is a longer conversation. We ultimately, did a little bit more testing and yeah, diabetes, but early. It wasn't in any type of crisis, which was great. We were able to manage it with diet and insulin. We had the owner come back the next day. We showed how to administer insulin, and we did what's called a blood glucose curve. So just evaluating the glucose, over a period of time. Again, all of this, collection really to paint the picture of how best to treat this cat. But yeah, so it was really rewarding. The cat got the care it needed before, right? Some sort of crisis happened. And the owner, thankfully, was, very appreciative. We caught it early. And of course, it's a little easier on the pocketbook at the end of the day when we catch something early than after the fact.
Absolutely. I think from all angles, it's very clear that when we catch things early, we're better able to manage them. It's better for us, it's better for the cat. So I really appreciate all of the work that you do. And I really just thank you so much for this conversation. Thanks for being here.
Oh, of course. This was great. Thanks for having me. I really appreciated the time.
As part of your cat's care team, it's important to pay attention, investigate your cat's well-being, and not wait until serious signs occur. I hope that this episode reminded you to schedule that overdue vet visit and gave you some tools to make the appointment a success for your cat. Thanks so much for listening. If you enjoyed this conversation, follow Not Just Fluff on Spotify, Apple Podcasts, or wherever you listen. See you next time.